Welcome to Laerdal Medical. Laerdal Medical is a medical equipment and medical training products manufacturer based in Stavanger, Norway. Our mission is helping save lives through innovation in resuscitation equipment, medical technology and healthcare products. Our vision is that no one should die or be disabled unnecessarily during birth or from sudden illness or trauma. Our aim is also to reduce neonatal and maternal morbidity and mortality. In a traditional circle of learning, initially students would go through classroom learning and followed by clinical practice, where they will handle human in real scenario. They would lose their confidence and don't know how to handle, because many of the necessary skills which are required in emergency situations are dangerous and unethical to allow untrained personnel to practice. Furthermore, during these emergency situations, emphasis is often placed on saving the patient and not on training and supervision. The critical skills should be taught and practiced repeatedly in controlled and safe environments. Resuscitation teams should practice as a full unit and hone their coordination and organization, resulting in better team performance in real-life situations. Why? Simulation. Simulation is a technique, not a technology, to replace or amplify real patient experiences with guided experiences. Simulator training addresses all error categories, allows training of critical decision-making processes and crisis resource management training, realistic training of difficult and/or rare cases, safe environment. Simulation, experiential and immersive learning. Which factors impact survival? It is not often that groundbreaking new scientific or medical developments come through that change patient outcome. However, it is only through good training of staff that the current protocol can be successfully applied. Learning circle. Knowledge acquisition. It is a traditional method of learning where students get in-depth theoretical knowledge. Skills mastery. Simulation method of learning approach makes the students to mastering in their respective skill set areas. Decision-making practice. In the recent times, we have more latest technology innovations happening around the world. With the use of these tools, we can build our decision-making skills. Simulation in team. With the in-depth theoretical knowledge, students can do simulation method of learning to improve their skill sets. Clinical practice. Continuous practice through simulation method. Students are very sure and build immense confidence in performing well in the real scenario. Simulation in team. Educational institution environment. Simulation has been widely used in airline industry, military and law enforcement, but relatively new in medical. This educational tool is quickly expanding internationally. The high-fidelity simulators are technologically advanced training tools. They are computer-generated and anatomically realistic. They are able to be programmed to reflect clinical patient representation, including blood pressure, carotid and radial, femoral, popliteal, pedal pulses, as well as respiratory, cardiac and bowel sounds. Students also learn ECG interpretation, intubation and defibrillation. They are dynamic and interactive and able to verbally respond to questions and clinically respond to intervention. The exciting features of the simulators are the ability to create patient scenarios appropriate to each student course level. All of this takes place in safe environment, allows to make mistakes without having patience. In high-fidelity simulation, students are tested to assess their ability to think, and perform in a simulated environment. In reviewing the video with the student, we have objective evidence of what they did correctly and incorrectly. The goal of the debriefing is not to chastise the student, but to identify and improve knowledge and skill deficits in order to improve patient safety. In an army environment, medics go through advanced individual simulation training program. They take a real-life situation and represent exactly what they see. They have one of the or the largest simulation centers in USA with respect to high-tech mannequins. Simulators talk, bleed, and features like blood pressure and pulse, chest rise, eye blink, pupil dilation, etc. is possible. They have mannequins which allow medics to practice hemorrhage control, airway management, IV replacement. Can practice lots of risky procedures without having hands on human. The mannequin features play an important role in their exercise and combat training program. It takes mental strength and discipline to focus on how to approach the patient. On successful simulation training program, they become the best trained medics. Why Laerdal? Our vision: no one should die or be disabled unnecessarily from sudden illness or trauma. Our values: a meaningful purpose, pride in our history, a clear vision, a sound company culture, an excellent reputation, a passion for continuous improvement. How we do? Integrating simulation into traditional teaching models improves learner proficiency and offers them a more progressive and comprehensive skill set. We are proud to say that this focus on collaboration has resulted in strong alliances and partnerships with the National League for Nursing, NLN, the American Heart Association, AHA, and many other organizations. We have assisted 400 plus facilities worldwide to create sophisticated, state-of-the-art clinical simulation labs, and each was based on unique specifications and needs. What we do: traditional learning circle and simulation method of learning. Knowledge acquisition, skills mastering, decision-making practice, simulation in teams, clinical practice. We thank you for your valuable time provided to us in listening to Laerdal Medical Presentation.